Healthcare workers here in New York City will have a choice: get vaccinated or take a COVID test every week. Mayor Bill de Blasio announced this new city policy on Wednesday, saying that it's time for a new approach because the Delta variant has led to a spike in cases. Healthcare workers are more exposed than the general population, and many aren't vaccinated yet. The mayor had been reluctant to make COVID vaccines mandatory. He says the vaccine or test option gives healthcare workers a fair choice. Well, it's not yet clear whether or not the mayor is going to further expand this policy to other city employees like police officers, teachers and firefighters, or just limit it to people working in hospitals and clinics. On the whole, hospital workers tend to be vaccinated at higher rates than the general population. 70% of hospital workers are fully vaccinated, but in the city's public hospital system, the vaccine rate's lower. It's at about 60%. And one of the reasons for that low rate is that about 44% of those workers are black, and they're worried about the safety of the vaccine. Many of them say that there's a history of racist medical experiments in this country, and that makes them afraid of getting the shot. Many also don't trust pharmaceutical companies. Some have also told me that they're concerned about the side effects from the vaccine. The city's biggest private hospital, New York Presbyterian, announced last month that it would require employees to be vaccinated against coronavirus, but that's not yet been fully enforced. There are still 2 million adult New Yorkers who've not been vaccinated against COVID-19. Many of them live in poorer neighborhoods where there is a majority of African Americans. Now, convincing more adults to get the jab is a pressing concern here, as over the last week we've seen a case count spike to almost 600 a day. That's more than double the daily average in late June, and that has led to fears that there could be yet another wave here in New York City.